Hello, I'm interviewing Miss Paula Cashy here on skin cancer.
Good morning, Enzo. Thank you for inviting me to speak with you about skin cancer. Because I've had a little bit of problems, I guess I can tell you what has happened to me. Do you know what skin cancer is?
No.
Skin cancer is a disease on the skin because you haven't used protection. Do you use sunblock, Enzo?
Yes, and I use it everywhere that's exposed to the sun so that I don't get sunburned.
Good. Well, and so that you don't get skin cancer either. Okay, because when I was little, they didn't have things called sunblock. So when we went out, we would put suntan lotion on, but it didn't block the rays of the sun. Okay, and so that penetrates down into your skin, and sometimes it forms little freckles. Do you have any freckles?
Yes, many.
Okay, so I had some freckles too. Now, because I live in Florida, what I do is I actually go to a dermatologist. Do you know what a dermatologist is?
No.
A dermatologist is a skin specialist. So when you live in Florida and you're older, you go once a year and they do a check on all of your body. And they look for those little freckles that you and I talked about, okay? And if the freckle isn't totally round, okay, or it's a funny side one way and different way the other way, then they think, that might be suspicious. So sometimes they remove those and they're no problem at all. They just send them to a pathology. Do you know what a pathology is?
No.
A pathology is where they take the skin and they put it under a microscope and they analyze it to see what kind of disease it has. And usually the pathology report comes back okay. Well, this last one that you and I are talking about right now, I had a little freckle right here on my chest, and that's called your clavicle. And they said, gee, that looks a little bit funny. And what they did was they took a piece of it off, and they sent it to the pathologist. And they did a report on it, and they said no, that it was a little bit bad.
So what exactly happened after that?
So that they leveled it a moderate medium. And what that means is there's a high and then there's a low, and I was in the medium, but I was on the high side of the medium. Okay?
So that wasn't good, that if you did not go straight there and get it cut, you would have it would have gone to the high?
That's correct. That's correct.
How many, is there only 4 levels or are there a couple more?
There's only 3 levels. It's low, moderate, and high. Okay?
Oh, so I thought that there was 2 in between them.
Well, it was like if you have an A or a B, okay, and you have a medium B, okay, is that another level? Not really, right?
No.
Okay, well, that's the way this is. So
Okay,
so they sent this to the pathologist, and he came back and said it's not very good. So then they called me back into the doctor's, and they took a little piece off, okay, another piece off of my skin, and then they did another test, and they said it still isn't good. They have to wait till they find good, healthy skin, okay? So then whenever they find the good, healthy skin, they sewed me back up, and now I'm fine.
did you have to take any medicine to get rid of this disease?
The only thing I took was an antibiotic, not so that I wouldn't get infected, okay?
How long has this been at work? Is this a work in progress, or did it just rise up right after you got burnt?
No. Probably it happened when I was your age, and they only found it now. So what you're going to ask me next, I know, is it's going to come back, and I have no idea of knowing whether it is or not. That's why you go to a dermatologist every year to be checked, and if they think there's something suspicious, then they'll take care of it right away.
So right now you can prevent it, but once you get to your age, if we were sent if we got burnt now and we didn't, so we would get some cancer eventually when we get older.
Probably, right. So you want to be preventing your problems.
So we can prevent it now instead of just waiting
That's
until then and getting it cut.
That's correct. Okay. Well, I thank you for interviewing me. Is there anything else you need to ask me?
No.
All right. I would just tell everybody who sees this, make sure you use sunblock.